A health alert, multiple confirmed cases of measles in the D.C. area. The D.C. Department of Health putting out a notice of possible exposure locations. This as the measles vaccine rates are dropping nationwide and more outbreaks are certainly possible. Sarah Robinson has everything that you need to know in order to stay safe.
The measles virus can stay in the air about 2 hours after an infected person leaves the space, which is why exposures at places like metro stations are such a big deal.
People are coughing and sniffling and rubbing their nose and stuff, and it's gross.
Of course, it's alarming and scary.
Measles cases have been climbing across the United States over the past year, and now D.C. health officials are investigating possible exposures involving district residents.
When we think about the measles virus, it's actually one of the most contagious viruses known to humans.
In just the last few weeks, multiple confirmed cases have been reported in the D.C. area. Officials have not released an exact number, but they have identified 12 possible exposure sites across the district. St. Vincent de Paul Chapel at Catholic University is just one of 3 locations here on campus where there was a confirmed measles exposure. Another site, the March for Life rally and concert, an event that drew large crowds from across the country.
In areas where the vaccination rates have dropped, you're going to see significantly elevated cases of the measles because of how contagious it is.
Measles spreads through respiratory droplets, and symptoms don't always show up right away. They can appear up to 21 days after exposure, starting with fever, cough, and runny nose.
About 3 to 5 days later, a red blotchy rash can occur.
Dr. Linda Nabha says the MMR vaccine, which protects against measles, is safe and highly effective. The biggest concern right now, vaccination rates are slipping, including here at home.
Among kindergartners in DC, the vaccination rate was about 92 to 93%, and that has been decreased over the last couple of years. So we really want to get to that 95% rate, and we're just below it.
Health experts say any community below that 95% threshold is at risk for outbreaks, and measles isn't just a childhood illness. It can lead to severe complications, including brain swelling, paralysis, and even death.
Yeah, it is scary, and it's also very well documented in the literature too.
The 2-dose measles vaccine is highly effective at about 97%. For the full list of possible exposure sites, head to WUSA9.com. In Washington, I'm Sarah Robinson, WUSA 9.